Heather Loeb, as a therapist, as a marriage and family therapist intern, you are working at Rader Institute and helping a lot of people get over this thing that we've been studying on eating disorders. You have a way of looking at therapy when I've spoken with you that's not so much about the therapy and then trying to get everybody to do the right type of therapy. It's you shook your head. What's coming to your mind?
It's really about the relationship. You know, it's really important to look at each individual and where they're at, what they need. My job is to fit them. I work for them. You know, at Rader Programs, we're really involved in making sure we're meeting the client where they're at. And so that really means that we have approaches that are going to fit anybody that walks through the doors.
And it's nice that in this profession we have a lot of different types of therapies that are available.
Absolutely.
So if we go down some of the lists, let's say cognitive behavioral therapy. Describe that.
Cognitive behavioral therapy is probably one of the most researched treatment methods when it comes to eating disorders. And we really see that CBT, cognitive behavioral therapy, is one of the most effective ways of approaching treatment.
Because?
Well, what we do is we sort of break it, we break the eating disorder down into three really distinct categories. So we look at thoughts, we look at feelings, and we look at behaviors. Okay. And we look at the way thoughts feed into feelings, and the way those feelings then affect our behaviors. Okay. So for instance, if we want to look at maybe a thought that, you know, I'm out of control. Things have really gotten out of control and I can't stand this. That leads to a really anxious kind of feeling. And an eating disordered individual is going to take that feeling of anxiety and either go to food restricting, go to binging, go to compulsive exercising, something to kind of compensate for that feeling.
And so how does the therapy help?
Well, what it really does is it almost works to reprogram a person in a way. You know, the thinking has become over time very rigid. And so what we want to do is look at the thinking and look at how we can change the way that we think about things so that I see the world in maybe a more realistic way than I have in the past. And then we stave off those feelings of anxiety and then hopefully the behaviors.
Okay, so cognitive behavioral therapy is providing phrases that they can say instead of this phrase. Is it that detailed?
Yeah, you know, the great thing about cognitive behavioral therapy, it's a really concrete way to approach an eating disorder so that we can look at, you know, writing down specific thoughts that I'm having. So maybe a thought is, the world is out of control, my life is out of control, right? And then we want to look at, we can write down the feeling that is associated with that, say anxiety, panic. Okay. And then we can write down after that, you know, what's the behavior I want to go to compensate or to deal with that feeling.
Okay, so I can either choose to get anxious, binge, purge, refuse to eat, over-exercise. I can do that series of actions. Or I can do these series of actions. Right. What are these series of actions that are better?
Right. What we want to do is look at some real concrete ways to cope. You know, we have our patients generate a list of coping skills that they can use. Sometimes it's reaching out and calling a friend. Okay. Sometimes it's journaling and doing some self-reflective work. Okay. Sometimes it's something like bibliotherapy where you want to, you know, crack open a book and read something inspirational or read something that's really meaningful to you. Other things are just listening to music, doing mindful activities.
Being creative.
Absolutely.
Being productive, being helpful.
Absolutely.
Being crazy and happy and playful.
Yeah.
Okay, so that's cognitive behavioral therapy, is creating a difference in the way you behave based on the cognitive thoughts and the feelings that are coming up about that. Okay, so that's very concrete, very specific. You can define it. It's doable. Everybody can kind of trace the progress on that. But what's another type of therapy?
Another big treatment approach we use is family systems work. Okay. Family systems work really looks at the family as a whole. What we have a tendency to do is look at the eating disordered individual just as sort of the sole focus. And what we want to do is sort of broaden our scope to include the whole family, so that we're looking at what's going on in the family that's contributing to the eating disorder, and how does the eating disorder then feed back and affect the family.
Okay, so the family we've been hearing about with the eating disorder. You have family people saying you're beautiful, you're not, you need to be more of this, you're not enough of that, or someone in the family needs to be lifted up, and there's a lot of attention on that. So a person can develop all sorts of different responses to all sorts of different family situations that go on. That's just life, that's human nature. So does the family therapy bring everybody together, or and then you have that complicated collection of people?
Yes.
Oh gosh, that's powerful.
Yeah, that's the goal. It's to have everybody in the room and to really be able to talk about communication, to talk about, you know, different relationships and the complexity that comes along with individuals coming together, living together, loving each other, and working through some of the things that maybe have caused distress for the eating disordered individual, as well as the people who love them.
Okay, so the saddest situation you can remember with a family.
Yeah. I think that the saddest thing I see is for my clients to believe that they're being judged so harshly by their parents that they can never live up to the expectations. And these parents have no idea that they've set these expectations, or that their child has interpreted what they've said or done to mean that they're supposed to be perfect. And just my clients, when they are trying to live up to these unachievable expectations that they think that their parents want, and yet it's killing them. I think that's just the saddest thing.
And when the parents go, oh no,
it's almost like you see steam coming out of their head, you know, because their whole world has been wrapped up in trying to please this, meet this standard that is impossible. Yeah.
Okay, we move from family therapy to what?
You know, there's also a way to look at a patient through a sort of psychodynamic lens.
Okay.
And really what that means is, you know, essentially a huge part of that is bringing what we call the unconscious into the conscious.
Okay.
Right? So we want to look at what's propelling the eating disorder that maybe the individual isn't recognizing. Right? Those are really powerful forces, but what happens is that the individual has no idea that they're acting in compulsive ways because of maybe something that happened earlier in life, maybe some disruption in attachment, somewhere along their development, something happened.
So psychodynamic therapy is the process where you are working with that person deep inside of who they are. Crevices that they don't even know are part of their being,
Right.
into memories, into experiences, into perceptions that come out in dreams, come out in behaviors, but they have a deeper hold on their unconscious part. So then the psychodynamic therapy is a tool for helping people when they know or suspect there's something much deeper going on. What's the next therapy that's available?
You know, when we talk about different approaches, I think personally one of the most effective ways to treat eating disorders is really group therapy. And group therapy gives an individual the opportunity to get some feedback from other people who are suffering. You know, what's worked for them, what hasn't worked, some kind of feedback on, you know, I'm not the only one experiencing this, and how amazing that is to know they're not alone.
So at Raiders, do you do all these different types of therapy?
At Raider programs, we do everything. We do individual work, we do family work, we do groups, we do couples. It's so important to get everybody involved.
Couples therapy.
It is.
Tell me about that.
Couples therapy is a really amazing, powerful way to treat an eating disorder. You know, because when we're in a relationship, our spouse, our partner, they're affected sometimes just as deeply as the eating disordered individual is. They're the ones that are going to be the primary support for the individual once they leave our hospital. And certainly they need to be on board with how best to support the clients.
Any other type of therapy? Art therapy, drama, reality therapy?
All of the above. All of the above. What I think is most important is to really offer the client every possible resource to do all of the work that they're going to be needing to do.
Okay. Thanks, Heather.
Thank you.
Heather Loeb. As a psychologist, I work with individuals that have all sorts of different personalities and all sorts of different reasons as to why they've developed different complications that they don't want to live with. And Heather Loeb has really described very clearly that there are so many types of interventions that are available for you that you don't need to despair about one not working, because you will find a match for your style, for your difficulties, for the situation around you and your family that will actually be able to move you toward what you want in your life. So don't despair. Eating disorders are difficult to deal with, but there's so much research out there about what can help you, and people who are experts that know exactly how to match you with the intervention that frees you up. So thanks for joining us today.
Thank you so much.
Thanks, Heather.